A newly developed blood test for Alzheimer's disease has raised significant hopes within the medical community, providing both a reliable means of diagnosing the neurodegenerative condition and a way to measure how far it has progressed. While current blood tests for Alzheimer's are primarily used to detect the presence of cognitive symptoms, this new test offers the crucial advantage of identifying the severity of the disease, specifically by detecting tau protein aggregates in the brain. Researchers at Washington University in St. Louis and Lund University in Sweden have demonstrated that measuring the blood levels of MTBR, tau 243, a marker of these tau tangles, can accurately reflect the extent of Alzheimer's disease progression. This breakthrough holds promise for both clinicians and patients. Traditionally, diagnosing and tracking the progression of Alzheimer's has relied heavily on expensive, time-consuming brain scans, such as positron emission tomography, PET, which are not always available or affordable. These scans, while highly accurate, are impractical for routine clinical use, especially outside major research centers. The new blood test, on the other hand, offers a much more accessible and less invasive alternative. In clinical practice, it has the potential to quickly and efficiently help doctors determine whether a patient's cognitive symptoms are caused by Alzheimer's, the stage of the disease, and whether they are likely to benefit from specific treatments. The study, published in Nature Medicine, found that MTBR, tau 243 levels in the blood were highly correlated with the amount of tau tangles in the brain. In fact, the test showed 92% accuracy in distinguishing between early and late-stage Alzheimer's, as well as identifying Alzheimer's-related dementia from other forms of cognitive impairment. This ability to distinguish between different types of dementia is a critical step in ensuring that patients receive the correct diagnosis and appropriate treatment, as many forms of dementia share similar symptoms. A notable strength of this blood test is its potential to enable earlier and more precise intervention. Alzheimer's disease therapies are most effective during the early stages of the condition, yet diagnosis is often delayed until the disease has progressed significantly. By identifying the disease earlier and assessing its progression, the blood test could help doctors tailor treatments to individual patients. This is especially important as new treatments targeting tau, amyloid, and other facets of the disease are in development. Personalized medicine for Alzheimer's could soon become a reality, allowing doctors to select the most effective treatments based on the specific stage of the disease. However, while the potential of this blood test is immense, there are several challenges that need to be addressed before it becomes widely available for clinical use. First, the test has only been validated in a limited cohort, and more research is needed to confirm its accuracy across larger and more diverse populations. Additionally, the test is not yet approved for widespread clinical use, although its development by WashU and C2N Diagnostics may accelerate its availability. Despite these hurdles, the breakthrough represents a significant step forward in the fight against Alzheimer's. The ability to diagnose the disease and measure its progression with a simple blood test could ultimately lead to earlier diagnoses, better targeted treatments, and improved outcomes for patients. As research continues and more therapeutic options emerge, this blood test could play a crucial role in managing Alzheimer's disease and providing patients with the personalized care they need. In conclusion, while this new blood test for Alzheimer's holds great promise, it is important to remain cautious about its current limitations and the need for further validation. However, with its potential to revolutionize how Alzheimer's is diagnosed and treated, it is a positive development in the ongoing battle against this devastating disease. With continued progress, the future may see a significant shift in how we approach Alzheimer's care, moving toward more personalized, accessible, and effective treatment strategies.